Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A study published in the Journal of Nutrition in December of 2022 showed that most women should be getting an extra 25 grams of protein per day to prevent hip fractures as they age. This large study also showed that drinking coffee and tea helped to reduce hip fracture risk by an additional 4% per cup, as coffee and tea contain polyphenols that help to support bone density in a similar way as the hormone estrogen. So drinking more coffee and tea is helpful in preventing bone loss and reducing risk of osteoporosis. This is some breakthrough information here. The study, known as the UK Women's Cohort Study, followed over 26,000 women ages 35 to 69 years old for an average period of over 22 years. The study showed that women who ingested an extra 25 grams of protein per day had a 14% lower risk of having a hip fracture during that 22-year follow-up period. That's very impressive. A 14% reduction in risk if you're getting that extra bit of protein, 25 grams a day. As well, every additional cup of coffee or tea was associated with a 4% lower risk of developing a hip fracture. Now, it's not uncommon for women to consume inadequate protein, especially as they get older, and some experts feel that the RDA, the recommended daily allowance for protein, is set too low, and I agree with that. The RDA for protein is 0.8 grams per kilogram of body weight. Many experts feel that it should be 1 gram of protein for every kilogram you weigh on a daily basis to help optimize your bone density, muscle tissue, immune system function, because protein is required to make antibodies, as well as for other health reasons. And most women don't ingest this level of protein. The extra 25 grams of protein can easily be obtained by drinking a delicious whey protein shake, which is something I do personally 4 to 5 times a week. Whey protein has high biological value for supporting muscle and bone protein synthesis, as well as supporting your immune system. One chicken breast or turkey breast also contains 25 grams of protein, as do 3 to 4 egg whites, or a 10 to 12 ounce non-fat serving of Greek yogurt, or a 3.5 ounce salmon steak. These are all good low-fat, low-cholesterol sources of protein that I like. The salmon steak has more fat, of course, but it's healthy omega-3 fat. Also, you should know that 100 grams of tofu contains 17 grams of protein for individuals who are vegan or are trying to move towards a more plant-based diet, which I would also endorse. Substituting beans and peas for pasta, bread, potatoes, and rice can also help get you more protein while keeping your blood sugar lower, a very important consideration in the prevention of diabetes and weight gain, and for reducing overall risk of cardiovascular disease and some cancers. More beans and peas, always a good idea. You get more protein, more fiber, more anti-cancer nutrients. The takeaway message is that women should look at their diet to make sure they're getting sufficient protein each day. In Canada, 1 in 3 women will suffer an osteoporotic fracture in their lifetime. In the United States, osteoporosis prevalence among women increased from 14% in 2008 up to almost 20% by the year 2018. 1 in 2 women in the U.S. will break a bone in their lifetime due to osteoporosis. These are dreadful statistics. So overall, things are getting worse, not better, as the population ages. Adding 25 grams of additional healthy protein and consuming 3 to 5 cups per day of green tea and or coffee represent a couple of basic and easy strategies to help combat this serious health problem that disproportionately affects the female population. Of course, doing resistance exercise, strength training, weight-bearing exercises on a regular basis and ingesting sufficient calcium, about 1,000 to 1,200 milligrams a day, and magnesium, 300 to 450 milligrams a day, and maintaining a blood vitamin D level between 75 and 150 nanomoles per liter, or 30 to 60 nanograms per milliliter, are also critical strategies to reduce risk of osteoporosis. But you know that. You need resistance training, vitamin D, calcium, magnesium. Most women know that, but that extra protein and the cups of coffee and tea can also be very helpful. It's important to note that caffeine in coffee and tea can increase the loss of calcium from the body via the urine, so be sure to ingest at least 1,000 milligrams of calcium each day, more optimally, I think 1,200 milligrams, from food and supplements to guard against calcium loss, especially if you're ingesting coffee and tea on a daily basis. As you recall, the polyphenols in coffee and tea were associated with a decreased risk of osteoporosis in this very large UK women's study, but the presence of caffeine in these beverages does increase some calcium loss, so be mindful of that. I've included the reference for the UK women's cohort study in the text below. Thanks for watching, and I'll see you next time.